Good afternoon, everyone. My name is Garrett Schmidt. I am the managing editor of ACOExhibitHall.com. Thank you for joining us today to the live discussion hosted by BioReference Laboratories entitled Laboratory Diagnostics, an overlooked solution to reduce ACO member cost and close the gap between data and diagnosis. And there's a lot there. And we've got a great presentation planned for you today. A couple of notes before we get started here, a couple of housekeeping items. Everyone has joined today in listen-only mode, so you don't need to worry about muting your microphone. That's been done for you. So don't worry about that. And also the webinar is being recorded, so you're going to have an opportunity to rewatch the session and share it with colleagues, and we hope that you do. So the way it's going to work is right after the presentation, probably in the next several hours, I'm going to send out a link to the recording, and that's also where you can download the slides. There will be a little video that you can watch as well, and we're also going to have and I'm going to tell you where you can find it on the ACO Exhibit Hall website as well. Finally, during the webinar, we want to hear from you. So please reach out and ask a question. You can use your little attendee control module there. There's like a questions area that you can ask questions, and you don't have to wait till the Q&A in order to do that. So anytime you have a question, go ahead and submit it, and we'll get to as many of those as we possibly can during the Q&A time. And I think we'll be able to. We have a little bit of a shorter presentation for you today so that we can handle more questions. So we should have plenty of time for that. So again, please submit your questions there. But again, if we don't have it, aren't able to get to it for whatever reason, we'll make sure to get to that via email afterwards. So without further ado, I want to introduce Carlos Acosta, and he's the Senior Director of Strategic Venture Solutions with BioReference. So he's going to get us started. He's going to tell us a little bit more about BioReference and the Scarlet program for today. So welcome, Carlos.
Garrett, thank you. We appreciate the opportunity given to BioReference to present here. I think we just lost the screen here a little bit. Let me see if I can bring it back. There we go. Thanks again, Garrett. We appreciate that, and thanks everybody for joining this afternoon. As Garrett said, we're going to be very respectful of everybody's time and have it a little bit compressed than what we originally planned. But we wanted to speak today about one of our new offerings that was launched this year, which was Scarlet Health. And before I kind of dive into it, a little bit high-level overview on Scarlet Health and its platform. I wanted to take the opportunity to give a little bit of background or timeline around BioReference for some of you, those of you who might not be too familiar with BioReference. BioReference is the third largest laboratory, commercial laboratory in the United States, and it was incorporated back in 1981. Originally founded by a physician, currently still to this day, our executive chairman, Dr. Cohen, and our holding company CEO, Dr. Phil Frost. So very patient and very physician focused from the top down, still led by physicians. In 1986, it began laboratory operations known as BioReference Laboratory, and it was listed on the NASDAQ in 1986. Through the following years, it acquired several cytology and pathology and other organizations. In 1988, particularly Cytology and Pathology Associates. It commercialized and commenced its oncology testing in 1995, acquired GenCare, acquired OncoDoc Labs through its PCR testing, and also acquired Community Medical Labs. So in 1995, several acquisitions to continue its growth. 1996, it acquired Advanced Medical Labs and the renal dialysis division of GSK. Those of us who've been in the industry for a very long time will know that as GlaxoSmithKline Laboratories. Through 1998, 2 years later, it acquired Medilabs up in the Northeast also. And in the beginning of the next 10 years there, in 2000, it launched its GenPath Oncology and our CareEvolve. Many of our clients know us through our strength in our GenPath division, through oncology, through GenPath Women's Health, and GenPath Men's Health. In 2005, it launched the Women's Health Division of GenPath. And then in 2006, we acquired GeneDx, world leader in genetic testing, located in Maryland. 2012 was another pivotal year for BioReference, as it not only launched InCellDx, it acquired 2 laboratories in the state of Florida and expanded its footprint in a brick and mortar footprint into the southeastern portion of the United States by acquiring Florida Clinical in Central Florida and Meridian Clinical Laboratories in the southern part of Florida in Broward and Dade County. In 2015, probably another pivotal point in the timeline of BioReference, it was acquired by ACO Health, which is headquartered here in Miami, Florida. 2016, the following year, we launched the 4K score, which is a blood test for risk of developing aggressive prostate cancer. It can detect metastatic cancer up to 15 to 20 years out, and it still remains today a proprietary test of BioReference, which large emphasis from our organization on our oncology and our men's division. 2017, we affiliated with a population health platform company, and then in 2019, another pivotal year, we reached that mark of 150,000 exomes through our GeneDx division, and we were also named as one of the top organizations by Forbes magazines as the best employer. And coming into 2020, last year, as we all know, most of us in this industry had to make large pivots and adjustments, and BioReference was a leader in COVID and bringing out the commercialization test out to the communities, many states, many cities, municipalities, and again, still in today's time frame, affiliating with many sports leagues, the NBA, the NFL, Major League Soccer League, and into today, bringing back some tourism and bringing us back to a post-normal in our tourism industry, with several cruise lines putting in platforms and programs to help them with their COVID testing. And bringing us to today, current 2021, we launched our Scarlet Health, and that was launched at the beginning of this year. Scarlet Health is what we want to elaborate on today and convey today on our Scarlet Health offering and the platform. Scarlet Health is an in-home, fully integrated digital platform providing access to on-demand specimen collection services, obviously backed by BioReference and our national preference and infrastructure with laboratory facilities throughout the country. Scarlet delivers a very innovative, flexible, mobile alternative to our traditional patient service centers and other draw locations where phlebotomists and other specimen collections are needed. So in this post-COVID world, this offering really fits into what we're experiencing in our industry with RPM, with telehealth, kind of fits into that bucket there a little bit. So we've seen the new demand for mobile diagnostics. Always had long existing barriers to patient compliance. They have yet to be addressed. Interesting statistic is 70% of all medical decisions are based on laboratory testing and lab results. But 30% of those patients never have their lab test performed. Pretty significant number when we analyze the fact that 70% of all medical decisions are based on a diagnostic lab test. Some of the inconveniences our traditional method, service center method, which is patient centers are another inconvenient stop for busy patients. The anxiety around safety in this post-pandemic world, coming into a crowded environment, a lot of the patient service centers, whether it's commercial, whether it's within health systems, university systems, and so forth, very crowded areas, very limited access, sometimes to a nearby patient service center where the patient would have to draw or drive a longer distance of time, more time out of that patient's day to be able to access what we refer to as a PSC, or patient service center. Limited patient mobility due to particular medical conditions or lack of resources. Some patients, as we know, in the ACO environment and these MSSP plans would rely on family members or guardians or transportation to be able to a system to and from their medical appointments. And of course, the discomfort around fasting labs early in the morning, the time frame, and so forth, from when that patient has to be fasting from the previous evening. As we were mentioning, healthcare is adapting to a new way of working. As stats still today reflect that 30% of most patient visits are still occurring via telehealth or some form of telemedicine. Telemedicine's unprecedented growth during the COVID pandemic has transformed healthcare. $250 billion of the current healthcare spend could be virtualized with the acceleration of telehealth. 63% of the US healthcare practitioners have used telemedicine tools or some form of remote treatment. And 1 in 5 physicians expect to use video and telemedicine post-pandemic significantly more than pre-pandemic. And consumers are increasingly interested in remote care. We see that in every aspect of today's world. We're an on-demand society. We want our Uber, we want our food, our groceries delivered now. And this transition is reaching out also into healthcare. 57% increase in US patients who participate in at least one telehealth visit since the COVID-19 outbreak. 80% of consumers who have engaged in a telehealth visit say they're likely to have another virtual visit, even post COVID-19. So we see these surveys and these numbers continue to enforce and reflect the growth in a remote visit. And 41% of consumers are comfortable with the idea of using at-home blood tests. Before I go into even the physician experience, speaking about the at-home experience, we're seeing that a lot, particularly with value-based care. We're having a lot of conversations and seeing a lot of the organizations, particularly the accountable care organizations, in a solution to close, certain open gaps, certain metrics, and even when there is a full risk environment, being able to meet certain HEDIS scores. The laboratory experience and the laboratory portion of that metric is very important. So we'll start with the patient experience. Why is it different? Why is Scarlet different? There's no extra development. There's no system integration, and it's basically just a few keystrokes. It's available in your current EMR or any ordering platform that the healthcare provider utilizes. We simply add the Scarlet test code to any order, and we contact the patient and take care of the rest. It really is that simple. We call it 1, 2, 3, 4. It's a simple process. Following with the patient experience, the process starts. We break it down into the 4 steps. Initially would be the test ordering, where the healthcare provider, whether it's through a traditional office visit, where the patient is currently with that physician in an examining room or whatever that environment may be, or through a telemed consultation, the healthcare provider just orders the lab as usual, and Scarlet takes care of the rest. It's as simple as an additional code, just like ordering any specific lab test, whether it's a glycohemoglobin, a basic CBC, cholesterol. Scarlet is an additional test code, just like any laboratory test. Step number 2 is make the appointment. Scarlet uses an integrated digital workflow to coordinate the patient sample collection and appointment. Process 3 would be collect a sample. Our skilled phlebotomists arrive at the patient's location, whether that's work, whether that's home, any location the patient selects, ensuring a convenient, professional, and safe experience. And finally, the final step is results. Afterwards, results are seamlessly available to both the healthcare provider and the patients, enabling better care. We have an excellent patient portal that works in collaboration with our providers. That not only will the result go seamlessly, if it's a bidirectional interface, to a provider's EHR, or through our own web portal, Inside DX, where every provider and every healthcare provider would have access to the portal. It's a simple web-based portal. They'll be able, just like as the patient, through their patient portal, access their results. Not only will they be able to access their result, our patient portal is extremely vigorous. It gives the patient information about the type of testing they had, if they had any abnormals, gives them a lot of orientation, and always works them back to that physician. So patient engagement, I think, would be the key word there, which is a very important part of the process. We focus on experience. Scarlet Health technicians are highly trained, they're reliable, and focus on delivering the best possible experience. They are trustworthy, they're friendly, and they facilitate a pleasant and efficient patient experience. Specially trained medical professionals are a trustworthy extension of BioReference in your practice. Some more local companies would outsource their health technicians or their phlebotomists. We do not. Our BioReference technicians and phlebotomists go through a highly trained process. They're an extension of our organization, and when patients are allowing them into their home or into a workplace, we want to make sure that they're comfortable with that personnel reaching out to them. And we'll continue here on the next slide with the patient experience. So the process starts with the physician order. It's a simple text message or an email, either or the two mechanisms that Scarlet uses to request a home draw for lab work. The patient just clicks the link that they receive, and they just verify their information. As you can see on the second picture, they'll verify their name, they'll verify their date of birth, and then they opt for where they want that visit to take place. Where would that experience be done? Whether it's going to be home, whether it's going to be their office. Step number 2 is they'll select a time. Based on location, patient selects 2 different time slots that fit into their busy schedule. Some people ask us, why the 2 time slots at the very beginning? We felt and experiencing, as we have several organizations launching utilizing the Scarlet platform, that sometimes, in the busy style we have today, patients will pick Friday at 3 o'clock, and when Friday is coming along, they'll realize that either something came up, they had another appointment or a last minute, and they'll have to reschedule. So to eliminate the process of them going back in to the platform, into the portal, and picking a second date, initially they already have that second collection date selected. So it will default automatically to that second collection date that the patient scheduled originally, to make it more seamless for that patient. The phlebotomist availability in the area and travel time are all taken into account for these available time slots that will appear and be available to the patient based on their geographical area. The patient can update order demographics, insurance information. So if there's any discrepancy, let's say in the patient's chart in the EMR, maybe they change insurance, maybe there's a different phone number, whatever that detail may be of demographics, the patient always has the option to be able to update any of that information at this process in the experience. And also the eligibility integration to validate information is always provided. Step 3 are the real-time updates. And this is a really nice piece to the experience. After the patient schedules the appointment, the patient opts into receiving text messages, about updates. The updates, what do the updates covers? The updates cover how to prepare for a visit. Sometimes if it's a particular lab, it might be a fasting lab. So it'll make sure it gives them some information, reference the fasting lab and how many hours and so forth to assist that patient in preparation. And it will visually track the phlebotomist as they travel to the scheduled appointment. And this is, I think, is a neat portion of the experience. The on-demand world we live in now will track that phlebotomist. So typically 24 hours of the evening before, the assigned phlebotomist for that particular patient will reach out to the patient. They will contact the patient, introduce themselves, let them know they'll be there tomorrow for their scheduled experience. And that day of the visit, the phlebotomist, the patient, will be able in the app to be able to see that tracking that you're seeing on the slide, a picture of that technician who's coming, right? It's nice to know when someone knocks on your door that you know who they are because you've already seen a picture of them before they're coming to your home or your office. So it's a really neat part of the experience. And with that said, I wanted to just take a moment and just put up a video, a short 45-second video, so you can see Scarlet in action a little bit, a demo video that we have on our Scarlet Health website. And I will bring it up here. I went a little bit too quick on the slides there, my apologies. And I'll start the video here.
More and more, telemedicine is reaching millions of patients where they are, but it can't touch them. Now there's Scarlet, laboratory collection that comes right to the patient, because 70% of medical decisions are based on laboratory tests, and many patients just don't have the time or the access to get their laboratory tests done, or simply don't want to leave the comfort and safety of home. Scarlet provides on-site sample collection with online convenience. Healthcare providers order laboratory tests. Patients tell us where and when. Our health professionals come to take the samples. Patients and healthcare providers review the results. It's that simple and that evolutionary. Scarlet, it's where healthcare is going, and it's already here.
So there you have it. You can see why at the beginning of the session we said we wanted to be respectful of everybody's time and compress it a little bit. So we tried to do our best to give you a high-level overview of the Scarlet Health platform. So with that said, I'll hand it over to Garrett, and we'd be more than happy to take any questions during the next few minutes. So Garrett.
All right, great. Thank you, Carlos. That was a great, very thorough presentation and succinct too. I like that. You don't get a lot of that these days, so thank you for that. We did have a few questions that came in, so in no particular order, let me jump into these. The first is, can Scarlet be integrated into any EMR EHR system?
Yes, absolutely. It's a very seamless process. If it's an existing client or a new client, it's the same process. If it's an existing client and we have a test companion and usually a bi-directional interface, it's just a matter of adding that one test code, like adding an additional test code to a test compendium. And so it's very simple. We also have the ability to give healthcare providers access to it through our portal, but very seamless. Yes, usually my experience with several of the clients that we've onboarded with the Scarlet Health platform, about 7 days is what I've seen. We usually make a request to that EMR vendor. The client or the healthcare provider creates a ticket, how sometimes they call them, to allow us to go in. We work with their vendor, we create that test code, and sometimes that's usually done in about 48 hours, 72 hours. And then we launch a little team to work with that provider and their staff. There's always a medical assistant, a point of contact, or someone where we'll do a test order, make sure that everything flows through to us and everything flows, back to them bi-directionally. But very seamless. And my experience with our EMRs has usually been, very simple. It's just one code. I hope that answers the question.
Yeah, okay, yeah, no, thank you. Okay, second question here is Scarlet available everywhere, or is it only available in select locations?
No, that's a great question. So from the initiation of our launch, we've started in several states. So we're currently offering and active in the state of Florida. We're in Texas, in Dallas, in Houston. We're in New York, New Jersey, a lot of the states in the Northeast. I know we have clients and it is currently active and available. But our Scarlet Digital Health team is very experienced and very well prepared. So our experience has been that in certain areas, if we had someone, let's say in Georgia, or any particular state, any organization that had an interest in Scarlet, within 30 to 45 days, even if we don't have the infrastructure there for Scarlet, we can have it up and running and implemented in a 30 to 45 day time period.
Great. Okay, next question is, a few of our providers are not utilizing an EMR system yet. Is there any way to utilize Scarlet through another source or third party or website?
Yes, of course. So I have referenced Inside DX, which is our portal. It's available online, so as long as any provider has access to the internet and a computer, they would be able to utilize Scarlet through the internet. So very seamless, very simple. So either one of the two scenarios, with a EMR, without an EMR, Scarlet is accessible.
Very good. Good to know. Okay. Next question is, what is the time frame from like order placement to patient draw?
That's a good question also. So typically we're averaging about 48 hours. We always say 24 to 72, but we're averaging about 48 hours. Once that order gets launched in the physicians or the healthcare provider's EMR, it triggers it automatically with the code, comes to us. At that point, it gets routed based on the patient's demographic, the city, the zip code, to the available technician. And then right after that point, that patient is contacted, and so forth. But if I would have to sum it up, I would say we're in about a 48-hour window from order to draw. Some areas a little bit quicker, depending on infrastructures. We've got several organizations in the Northeast, let's say, and in the state of Florida. So I've seen some of the from order to patient contact fall in a 24-hour period also.
Okay. Next question is, can you please explain, as the title says, how does it close the gap in data and diagnosis?
Sure. So when we look at value-based care, when we look at some of the organizations where there's cost savings, for example, we know that, let's take, for example, some diabetic population. We know if a lot of these patients had to have their glycohemoglobin started testing, a lot of organizations with value-based are using Scarlet to close that gap, where there's patients that they need to meet certain metrics that have not been met, and they will use Scarlet with us and collaborate to be able to have those diagnostic lab tests performed at the convenience of the patient's home. When you have full risk scenarios, where there's full risk, it would affect, certain lab tests affect the HEDIS scores of these organizations. So the lab and the diagnostic piece helps close that gap also. And again, in the ACO environment, we know it's about savings. So certain patient populations, hypertension, diabetes, etc., have to have, need to be monitored constantly for the conditions. So you have FOBT, you have glycohemoglobin, certain cardiac tests. So that part of the population, let's say that 30% or 40% who never really gets their lab work done, Scarlet is a great resource to be able to close that gap and get that lab work performed on those patients that really need it. And we've seen post-pandemic, there's a little bit more hesitancy now to go to patient service centers. A lot of the patient service centers you need to make appointments with some of our competitors, and you have to wait a week. So Scarlet I think is a great solution and a great answer to that.
Very good. Yeah, no, that's great. And it's my understanding that you guys are working currently with some ACOs and big health systems.
That is correct. That is correct.
Wonderful. Okay. Next question here is, what are your plans to service rural communities where physical access to labs is a challenge?
And that's a great question. And that's another one of the nice experiences about Scarlet in the rural areas and certain areas and communities where patients don't have access to what we would traditionally say, let's say a patient service center. As we know, is in our environment, patients either get drawn at a physician's office or would get drawn at a patient service center. So Scarlet is a great option for these rural areas where you have limited access, either a hospital, a patient service center for that patient to be drawn. So Scarlet is a great answer and a great option for the need where there's a lack of accessibility.
Okay, great. And then lastly, we have had a couple questions come in regarding the cost and how it's paid for. If we want to find out a little bit more about that, how do we go about doing so?
Sure. So Scarlet right now, it's a service that BioReference is providing. We expect that we will have some payers be included in some payers, but depending on the organization, we work with each individual organizations where we assure that whatever the cost platform is or price structure is extremely feasible and a very affordable alternative to the what we call, the current ways. There's a lot of the plans that we would bill for. We bill for the regular lab work, and our billing department works very efficiently with some modifiers. So to let the plan know that we're performing a service, even though it's a non-reimbursable service, so there's no cost to the patient. So hopefully the answer would be that currently right now there's no cost to the patient.
Great. And we've had a few more questions come in, so we've got time. So we'll keep rolling through these.
Yeah, we made up for that compressed.
That's right. Next question is, are you fee for service, or will you take shared risk, or how does that work?
Absolutely. So both. Being the third largest laboratory in the country, we're in network with the majority, if not all, the major payers across the country. We're also in network with several Medicare Advantage plans and so forth. So we are both. The answer would be both. We definitely look at fee-for-service structure, and we also are able to work in a risk environment with a organization to be able to help them, achieve their savings. Absolutely.
Wonderful. Next question is, I know labs are drawn in 24 to 48 hours. How long does it take for the lab results to post?
So typically, in the current environment, right, we get our labs drawn, and usually the labs are, the specimens are shipped to the lab via an interior logistics setup, if it's a patient service center logistics. So we internally have our logistics coverage throughout the country. The specimens will be delivered to the lab the same day of the collection. So typically labs are ready the next morning, just like if you were to get the patient were to have their extraction done at the physician's office. If the patient would go to a patient service center, there is no difference in what we would say the turnaround time of those results being available to the patient. Now, I will add that for the patient portal piece, we do have a delay for the patient. So the physician has access to the results immediately when they're ready. The next morning, if the results at 4 in the morning, our system is always pushing through the EMRs consistently, but there is a few-day window that the patient will not be able to access their results in the patient portal intentionally to allow the healthcare provider to review and have access to the results prior to that patient having access to the results. I hope that answers that question.
Got it. Very good. So that concludes the questions that we've had, and I'm sure that there are more stirring out there. So if you have any that you're thinking about, and feel free to submit those. We'll continue to answer those via email after the presentation. So at this time, I want to thank Carlos. This was a great presentation. I think it was very thorough, and wanted to see if we could go on to the next slide. I wanted to let everybody know, as we conclude here, to encourage you to visit the ACOExhibitHall.com, and this is where you can actually go to the BioReference's Laboratories booth. They have an interactive virtual booth there that you can interact with the team, and there's a lot of material there, and learn more about them. And also at the ACO Exhibit Hall is where we are going to house the recording for this session today. So you'll be able to go into the library there at ACOExhibitHall.com and find, you can do a search for all webinars, but this one will definitely pop up here. Give us several hours, maybe this evening before this one is there. But I'm going to go ahead and send out, as I mentioned earlier, a link to the recording, and you can also get the slides there. So at this time, I just want to thank you all again for coming. And if you look on this last slide here, Carlos, if you can go to the last one, this is their contact information here. So if you want to reach out to him or any of the BioReference team, feel free to do that. there, or if you have any questions for me, feel free to reach out to me directly and I can put you in touch if need be. So thank you so much for attending. Thank you for your time. Thank you to the BioReference team and to you, Carlos. This is a great presentation. So hope you all have a wonderful rest of your day.
Thank you, Garrett. Thank you, everybody. Have a good afternoon.
Thank you.